we have a few different options when we talk about stem cell therapy. Number one, traditionally what people have been using is SVF, Stromal Vascular Fraction. That is generated by patient's own fat, so which is removed through very low invasive procedure through cannula, goes to the lab. In about 3 to 4 hours, the stem cells are ready. Other is mesenchymal stem cells. They are generally taken from umbilical cord of newborn babies, which are delivered through C-section. So after careful selection, cord is then chopped up, put in a container, flask or a petri dish, and they're cultured for about 3 to 4 weeks before the cells are ready for the patient. So what are the pluses and minuses of these two different cells? SVF, Stromal Vascular Fraction, it is autologous, meaning that it is taken from the patient, the fat is taken from the patient, and then the stem cells are put back into the same patient. That's not that big of a deal, as I'll explain later. The plus point here is that SVF also has many different type of cells. It has MSCs, mesenchymal stem cells. It has also endothelial progenitor cells, which are very potent in forming new blood vessels. And it has a couple other type of cells, parasites, for example, immune cells. They give somewhat of an advantage to the area or the tissue which has suffered cell loss. So this is the plus point is it is many different types of cells. MSCs, on the other hand, is a sort of single population of mesenchymal stem cells. But the minus point in SVF is that you can only get so many mesenchymal stem cells out of the patient, because as we age, the number of MSCs or stem cells goes down. So when we talk about umbilical cord MSCs, you can actually put in all the MSCs you want in that particular patient. Regenerative potential of umbilical cord MSCs is greater than the MSCs you have generated from the fat of an adult patient. So there is that distinction. Generally, what I would recommend for people who are seeking aesthetic treatments, that they use stromal vascular fraction, they use patient's own fat, and for example, alopecia or facial rejuvenation, for those purposes, SVF is ideally suited. So when we are talking about severe diseases, long-term diseases, when you want to help those patients, since you're restricted when we talk about SVF is the number of cells you're going to get out of a patient, that is a big restriction. With MSCs, you don't have that restriction. You can make as many MSCs, as many stem cells as you can. So for severe diseases, kidney disease, heart disease, neurological diseases, it's much better to use umbilical cord derived mesenchymal stem cells. So there's another therapeutic agent in regenerative medicine beside, which is acellular, that is exosomes. Exosomes are not cells, they're secretion of cells, cells that produce vesicles, and they have regenerative ability. I think there's a major misconception about exosomes. Everyone is running after exosomes. Of course, they're like small vesicles that stem cells also release, but the problem is all cells release them. So in an adult person's body, you will have exosomes from kidney, you'll have stem cells from fat, muscle, all these cells are producing. So if you take patient's own blood or their serum and use that as a therapeutic tool, it's not going to have too much of a regenerative ability. So the best exosomes are the ones that are derived from stem cells, specifically mesenchymal stem cells. So for that, you have to culture cells, then whatever media they are living in, they will secrete those exosomes in that media, and you collect that media, purify those exosomes, and then when you use those exosomes, they are going to have the best regenerative potential. So that's why you see there's a huge price variation when you go out shopping for exosomes. I've been told that you can buy them for as little as 10,000 rupees or something like that. And then there's a huge difference when you go and shop for something better. Those are the umbilical cord stem cell derived exosomes. They are about, 100,000 rupees or even more than that. So, but there is a huge difference as far as what the regenerative potential is concerned. So when we are talking about your health, you should consider what your expected result is and what result you are expecting, and you should choose accordingly. If you found this information useful, I'd like to request that you subscribe to our channel for more informational videos like this one.